Hello and welcome to this module, How to Address Oral Health and WIC Visits. The module is brought to you by Cavity Free at 3 at the Colorado Department of Public Health and Environment in partnership with the University of Colorado School of Dental Medicine. This module provides talking points about oral health for infants, toddlers, and pregnant women. Use the following slides as a guide to cover the important talking points during WIC visits. Oral health is an important part of overall health. Oral diseases can cause pain, and if left untreated, can result in serious infection. Oral disease creates inflammation and has been linked to other chronic diseases. Chronic diseases are those that can be treated but generally don't go away with treatment, like diabetes and heart disease. These diseases are helped by lifestyle changes. Participation in WIC improves the access to dental care that kids receive. Studies show that children who participate in WIC are more likely to have their teeth cared for by a dentist, and they were less likely to have an emergency dental visit. What are the best ways for you to integrate oral health into WIC education? You can ask questions. In the nutrition interview, the oral health questions that you ask will help identify caregiver concerns. Educate. Select the appropriate oral health information to pass on to caregivers based on the child's age and concerns raised by the caregiver. And refer. Children should be referred to a dentist by age 1. As WIC staff, you play a critical role in connecting families to the oral health care that they need. It's important to care for babies' teeth to prevent or reduce tooth decay, also known as cavities, in infants. Asking a question such as, "What questions do you have regarding care for Jordan's teeth?" is a great way to start the conversation in visits that include an infant. Listen for answers that will let you know if you can address brushing teeth, teething, bottles and cups, or eating and drinking. The following slides cover talking points that you can share with caregivers. When offering guidance about how to care for infants' teeth, you don't need to cover every single piece of advice in one WIC visit. Instead, choose which points would be most important to caregivers based on your conversation. Here are some examples. Before the first tooth appears, you can wipe the gums with a clean, damp cloth twice a day. This helps the child to get used to someone taking care of their oral health. Most young children get their first tooth between 6 to 12 months of age. Once the first tooth appears, it's recommended that teeth are brushed in the morning and before bed using a soft, bristled brush with a small head. For children less than 3 years old, a tiny amount of toothpaste, about the size of a piece of rice, should be placed on the brush. Toothpaste with fluoride should be used. Tell caregivers to brush their child's teeth for 2 minutes. Singing a song or using a timer help to make brushing fun. Toothbrushes should be kept clean and not shared with other people. And toothpaste should be kept away from children of all ages, as some kids like to eat it, which can be unhealthy. Treat toothpaste as you would a vitamin. Often the first 2 teeth to appear are the middle bottom teeth. Teething can cause the baby to drool and can cause the child to become a bit more fussy and cranky. Advise the caregiver to give the baby teething rings or cold teething toys to chew on. Don't freeze teething toys or rings, as this can hurt the baby's gums. Caregivers should ask the dentist or the doctor about over-the-counter teething medications, as some may make the situation worse. Infants should only have formula, breast milk, or water in a bottle. Tap water is a healthy option to put in a cup because it often contains fluoride and helps to prevent cavities. Never put juice or any sugar-sweetened drinks in a bottle. Advise caregivers not to put children to bed with a bottle. Doing so can cause cavities because the liquid inside the bottle stays in the child's mouth as they sleep, even if the bottle contains breast milk. Infants should be held when feeding from a bottle. Beverages served in a bottle may cover the child's teeth with sugar for long periods of time and can lead to cavities. Therefore, it's recommended that young children switch from using a bottle to using an open-topped cup when the child is 1 year old. If a caregiver mentions difficulty switching from a bottle to a cup, some tips you can offer include: give the child an empty cup to get used to the feel of a cup before putting in liquids. Use a non-spill cup during the initial transition from bottle to open top cup, though it should only contain water. Relate some success stories from your other clients. One example of a story is, last week I talked to a parent who is going through the same thing as you are. They put a plastic mat under the high chair and gave him a cup. That way there was very little mess. Limit eating and drinking to one area of the house and take the cup away when the child is finished. Let caregivers know that when a child is very young, a pediatrician, family doctor, or nurse may check the baby's mouth and teeth at a well-child visit. If teeth have erupted into the mouth, fluoride varnish may be applied. This sticky substance is painted on the surface of teeth and it protects the teeth against bacteria that cause cavities. As WIC staff, your role is to refer them to a dentist. It is recommended that a child is taken to the dentist by age 1 or when the first tooth appears, whichever is sooner. Dental referral lists can be found in the WIC office. As children become older, their diet and activities change. Good nutrition is especially important to teeth. Having a healthy mouth will also ensure that the child is able to chew their food properly, which will help them chew nutritious foods and vegetables. During the WIC visit with a toddler, the questions you're already asking caregivers include, how do you take care of Jordan's teeth? Has Jordan seen a dentist yet? This is a good time to listen for any points of education around oral health that you can provide. Additionally, WIC identifies nutrition risk factors for toddlers as it relates to oral health. Look up oral health nutrition risk factors in your WIC training materials to find out how WIC defines these risk factors. Note that you may need to escalate oral health issues to a nutrition risk counselor if oral health problems are causing difficulty with the child getting adequate nutrition. Advise caregivers during toddler visits to lift the lip and look inside the child's mouth once a month. They're looking for early signs of decay that show up as white lines or white spots, and these are often found near the gum line. Remind caregivers that these white spots can be kept from turning into cavities with proper diet and good preventative care. However, cavities need to be treated. If they are left untreated, they can cause serious infection. Similar to infants, toddlers should have their teeth brushed twice a day with a soft brush using toothpaste with fluoride. Never share toothbrushes and replace the toothbrush when the bristles are bent or broken. For toddlers who can spit intentionally, a pea-sized amount of toothpaste is all that they need. Children will need help from caregivers to make sure that they are properly brushing their teeth until they are about the age of 8 years old. The child can take a turn first, but then the caregiver should take a turn to make sure to brush all of the tooth surfaces, the front, back, and top, and the sides of the teeth. The best way for an adult to brush a child's teeth is to sit or stand behind the child and brush. Some tips that you can share with caregivers to help with brushing include that children like to do what adults are doing. Caregivers can model good oral health care by having the child watch as they brush their teeth. What we eat not only affects our overall health, but also the health of our teeth and gums. Eating or snacking throughout the day puts the child at risk for cavities and may lead to obesity. When snacks are given, choose from fruits and vegetables and avoid foods high in sugar. Sugary foods are not good for teeth and should be eaten in small quantities with meals. Children should drink fluoridated water between meals and drink other beverages such as milk during meals. Drinking water that contains fluoride helps to prevent cavities. If a caregiver must buy bottled water, be sure to buy nursery water that has fluoride. Juice contains sugar and can cause cavities. Limit juice to 4 ounces per day, served in a cup. Diluting juice with water does not keep it from causing cavities. Children's medicine can contain a lot of sugar to help it taste better, and some medicines can cause a dry mouth, which can increase the risk of cavities. To reduce the chance of cavities, advise caregivers to brush the child's teeth after taking their medication. If this isn't possible, give the child water to rinse their mouth. For children of all ages, if the child doesn't have a dentist, refer them to one. If the dentist is reluctant to see a young child, refer clients to a pediatric dentist. For help locating a dentist, call the Family Health Line at 303 692 2229. Oral health is especially important for pregnant moms and their baby. Pregnant people should schedule a dental visit to have their teeth cleaned and take care of other dental needs. They can also ask the dentist how to take care of the oral health of their baby. WIC already includes the questions related to oral health. For example, do you have a hard time chewing or eating certain foods? When you listen to the answer to this question, listen for how the expectant parent routinely cares for their mouth. If they mention a cavity, tooth loss, gum soreness, or has problems chewing food, refer them to a dentist. Oral health problems can also impact expectant parents' sleep, quality of life, and nutrition. WIC identifies nutrition risk factors for pregnant clients as it relates to oral health. Look up oral health nutrition risk factors in your WIC training materials to find out how WIC defines these risk factors. Educate expectant parents that teeth begin to develop in the baby as early as the 3rd month of pregnancy. Drinking water that contains fluoride will help the baby to develop strong teeth. The pregnant patient should take care of any tooth decay to reduce cavity-causing bacteria in their mouth. A parent or caregiver can spread bacteria to the baby the same way that germs from a cold are spread. If caregivers have cavities, the child is more likely to have cavities. Cavity-causing germs can spread from caregiver's mouth to a baby's mouth by sharing spoons or licking a child's pacifier. Because of hormonal changes during pregnancy, pregnant people are more likely to have swelling, tenderness, and redness of the gums. They may also experience bleeding when brushing and flossing. Inflamed gums, if left untreated, can lead to more advanced disease called periodontitis. Some studies have shown that pregnant people with periodontitis have a greater chance of premature birth or having lower birth weight babies. It's important that pregnant people know that dental treatment is safe during every trimester of pregnancy. This includes x-rays and local anesthetics. Expectant parents should ask the dentist for advice about their oral health care during pregnancy. If the client says that brushing is too difficult because of nausea, have the client rinse her mouth out with fluoride rinse without alcohol. If they vomit, have the client rinse the mouth out with water or a solution of water and baking soda. Remind them that it's important to brush and floss twice a day to prevent gum disease. As WIC staff, you are already talking about the importance of eating a healthy, balanced diet during pregnancy. This advice also supports good oral health. Eat foods that are low in sugar and avoid snacking too often. Drink water with fluoride. For families that want more information about fluoride in their tap water, they can find out about the level of fluoride in their water by searching for the Center for Disease Control's My Water's Fluoride website. Smoking also leads to poor oral health. Contact the Quit line if your client needs help to quit smoking during pregnancy. It's important that expectant parents know that dental treatment is safe during any trimester in pregnancy. Expectant parents should ask the dentist for any advice about oral health care during pregnancy. If your dentist won't see a pregnant patient during pregnancy, find a dentist who will. Thank you for watching our module. We hope that you've learned a lot about oral health. If you have any questions or about the information in this module, please contact the Oral Health Unit at the Department of Public Health and Environment.